Hi, everyone. We're just going to give people a couple minutes to come on in. All right, it's 2 o'clock, so I'm going to get started with the intro here. People can kind of come on in as they come. Good afternoon. Thank you for joining us. My name is Jay Fortune, Standpoint Office Manager. My role today is to help facilitate the webinar. If you have any questions during the presentation, please type your question in the Q&A tab, or you can use a chat as well, and I'll pass the question along to Tracy. Most of you probably know about our organization already, but for those who aren't as familiar with us, Standpoint is a statewide organization. We are a team of attorneys and advocates working to assist individuals who have experienced domestic violence, sexual violence, and trafficking when it includes domestic or sexual violence. We also provide assistance to systems professionals who work with survivors. We do this by facilitating trainings and answering calls to our action line. Examples of trainings we do are the annual New Laws trainings, monthly webinars for advocates, and other trainings by request. Our action line is answered Monday through Friday from 9 a.m. to 4 p.m. It is through our action line that our attorneys provide legal advice to survivors, and our advocates connect callers with resources, safety plan, listen and help callers identify possible options and next steps. This webinar is being recorded, and you can check it out on Standpoint's YouTube page. The link to the recording will also be emailed out to Standpoint's Legal Advocates listserv after the webinar. For today's presentation, I will share the chat, the PowerPoint, link to the PowerPoint in the chat box, if that's easier to follow along. And now I'm going to introduce today's panelist, Traci Thomas-Card. Traci is our advocate support and grant manager at Standpoint. Traci has been working in domestic and sexual violence advocacy since 2004. She has extensive experience providing advocacy support to victims, training advocates, and facilitating programming on consent, bystander intervention, prevention, trauma-informed care, and more. Traci is certified as a Title IX coordinator and a doctoral candidate in the Department of Organizational Leadership, Policy, and Development at the University of Minnesota. Her current research interests include the LGBTQ2SIA+ college student population, intersectionality, student development, and violence prevention. Take it away, Traci.
All right, thank you, Jay. So as Jay mentioned a little bit about Standpoint, we were formerly known as the Battered Women's Legal Advocacy Project. We made the decision to change our name to Standpoint in 2016, allowing us to recognize that we wanted our services to come from the standpoint of survivors. As you all know, we have a team of attorneys and advocates who provide technical assistance through the action line and who do trainings. Our attorneys each have their own areas of expertise, from immigration to criminal and civil law, family law, OFPs and HROs, housing, employment, campus, and confidentiality. Similarly, our advocates also have their own areas of expertise. However, all of us can provide safety planning, resource referral, crisis intervention, legal advocacy, support around Title IX, and support to advocacy organizations in the area. Statewide services that pertain to domestic violence and sexual assault are our areas of expertise, and all of our services are free, regardless of income, with no intake required. I'm going to stop sharing my screen for just a moment. Okay. So here are the topics that we're going to cover for today. We're going to first talk about how we define youth in our communities. Then we'll go over some of the facts, the statistical evidence that shows us the frequency with which youth are experiencing domestic and sexual violence. With the pandemic, we will certainly talk about how COVID-19, virtual learning, and violence are happening simultaneously. The primary focus of today is to help us to understand how the roles of a school-based social worker and the role of a community-based advocate can come together and bridge these connections. And then we'll end with any questions that you might have. Although, as Jay mentioned, please feel free to type questions into the chat at any time. And before we get started, I do think it's important just to talk about why I decided to do this webinar today. So Standpoint has continued to develop a really robust intern program comprised of both legal and general interns. And this year, we were fortunate enough to have 2 MSW students join our team. One of our MSW interns intends to go into school-based social work after graduating, Lindsay. So she and I were talking about our passion for working with student populations, and in the course of our conversation, realized that she didn't know much about what an advocate's role was, and that I didn't know much about what school social workers could do. And so we created this webinar with the purpose of helping advocates and social workers to understand one another's roles, and more importantly, how we can work together to provide services for students who are experiencing sexual or domestic violence. So what do we think of when we say youth? So the definition of youth is really the period between childhood and adult age. And the World Health Organization changed the age range of adolescents from 10 to 19 to 10 to 24. And that change was to accommodate for things like policy and social services, recent findings in brain development research, the job market, and financial independence. I think it's important to note that the definitions often will vary between legal, societal, and cultural contexts. So it's important to think about who is included in this definition of youth, and also who is being left out. The definitions often work against each other and are overly restrictive, and these inconsistencies sometimes contribute to barriers to accessing services and issues such as aging out of programs for youth. For this webinar, it's really important to know that social workers in schools work with school-age children through the age of 21 as long as they haven't received a diploma, whereas advocacy programs may define youth less broadly or more broadly depending on the scope of the services that we provide. Unfortunately, we know that the intersectionality of people's identities often plays a role in how they're treated if they do seek help. We know that people of color, people within LGBTQ2SIA+ communities, and other underserved communities are often disproportionately affected by domestic, dating, and sexual violence. And unfortunately, youth in these and other communities often will face even more barriers when they do seek resources for help or support. So Jay, let's go ahead and start with one of the polls. Here we have a couple poll questions for everyone. So nearly 500,000 high school students nationwide experience physical abuse from a dating partner in a single year. Is that true or false?
Looks like about 17 of you have responded, so I'm going to end the poll.
And Jay, I can't actually see the results of the poll, so.
All right, looks like 88% said true and 12% said false.
Okay, and do you mind reading the answer to the poll or posting that?
Sorry for the delay on that. So the answer to that question is false. 1.5 million high school students nationwide experience physical abuse from a dating partner in a single year.
Thank you, Jay. And let's do the second poll real quick. So over 26 million kids in the US experience trauma and violence. Is this true or false?
Looks like we have about 15 people responding. 93% says true, 7% says false.
All
And
right. Oh, sorry, Jay, go
that's
ahead.
okay. And the answer is false. Over 46 million kids in the United States experience trauma and violence.
Thank you. So, our polls gave us just a couple of examples of just how many youth are affected by abuse at some point in their lives. And I really think it's important to just go over a few more statistics that I hope will demonstrate why, as advocates, it's important for us to connect with staff such as school-based social workers who might often be situated to also help the youth that we're providing services to. So we know that about 1 in 4 girls and 1 in 13 boys experience child sexual abuse at some point in their childhood, and that 91% of child sexual abuse is perpetrated by someone the child or the child's family knows. The Education Department found that reports of sexual violence at schools rose from about 9,600 in the 2015-2016 school year to nearly 15,000 in the 2017 and 2018 school year. That's an increase of more than 50%. Similarly, there have been at least 330 lawsuits filed against the United States since the beginning of 2018, alleging that the K-12 public and charter schools failed to protect students from sexual assault and harassment or mishandled incidents that came to light. During a 1-year period in the United States, 16% of our youth ages 14 to 17 had been sexually victimized, and over the course of their lifetime, 28% of United States youth reported being sexually victimized. And we saw from the statistic that nearly 1.5 million high school students nationwide have experienced physical abuse from a dating partner in a single year. We also know that we also know that 30% of people ages 12 to 21 in heterosexual relationships report experiencing psychological abuse in the past 18 months. 20% of youth in same-sex relationships report experiencing the same type of abuse. We also know that LGBTQ2SIA+ youth are twice as likely as their peers to say that they've been physically assaulted, kicked, or shoved at school. And among that same population, 17% of these youth report that they've been physically attacked. We also know that 1 in 4 teenagers is harassed or abused through technology. So with COVID-19 still raging across the world, many schools have moved to remote learning options. Students are taking classes virtually, sometimes with the use of technology and other times not. And as we know, the pandemic has caused additional challenges for victims who may want to seek help. For children experiencing abuse, the challenges are even greater. There may not be anyone that they can reach out to or any way for them to safely do so as they might in a face-to-face learning environment. A recent example from the news highlights the importance of being aware that students in K-12 environments are often experiencing abuse at home. So this is a recent case that happened in Chicago. An 18-year-old man who was out on a bond for a gun case live streamed himself sexually assaulting a 7-year-old first grader who was on break from her remote learning class. This assault was broadcast on a daytime website accessible to many young students. Fortunately, when the teacher saw what was happening, she repeatedly ordered all of the students to log off and then called the police, the school principal, and the Department of Children and Family Services. In this situation, officers were able to go to the victim's location, and the man was arrested after she identified him. And so I think this example illustrates just one type of abuse that we know children are experiencing, and unfortunately demonstrates how the remote learning environment can often have an impact on many students. And yet technology itself isn't the problem. It never was. The abuse itself is the problem. So as advocates, I think it's important to know how the schools in your area are operating to be able to provide the appropriate resources for safety planning with youth who might be experiencing abuse as they're isolated at home, or who may be experiencing abuse through technology or other situations that might occur. When Lindsay, our MSW intern, and I were talking, I asked her, how are school social workers working with students during COVID? And she told me that in some schools, there are small social groups where students can connect to their social worker online, but with that option comes the expectation that the students actually log in, which could present certain difficulties if internet access is a problem, or if the abuse is happening, during the time that the students are supposed to log in. She also told me that schools used to have in-person social pods where students could connect with their school-based social worker, but unfortunately, due to COVID, a lot of that has been eliminated or reduced for safety reasons. So ultimately, what I took away was how social workers are connecting with youth during the pandemic is going to vary really based on the school district policies in your area. Regardless though, Lindsay said that there would be contacts at the school districts in your area who could put you as an advocate in touch with that school social worker. Switching between screens here. All right, despite the frequency of youth experiencing violence, we know that youth aren't going to seek help for a variety of reasons. And those reasons could include things like a distrust in the system, a lack of awareness of their legal rights, feelings of shame, or not wanting to get the person harming them in trouble. It could also be that they're unaware of advocacy or social workers or other resources for support. Unfortunately, the impact of domestic and sexual violence on youth, as with many survivors, often takes its toll on their physical, mental, and behavioral health. We know that physical health is often impacted by the possibility of unwanted or unplanned pregnancies, physical injuries, or chronic conditions later in life, such as heart disease, obesity, and cancer. Mental health impacts of dating, domestic, and sexual violence include the possibility of depression, post-traumatic stress disorder, or anxiety. And behavioral health impacts include the possibility of self-harm, substance abuse, drug use, risky sexual behaviors, or increased risk for suicide or suicidal attempts. I always like to talk about how, as an advocate, it's important to recognize that not all survivors are going to suffer these impacts, and some might suffer multiple impacts. So I want to talk a little bit why I think it's really important for social workers and advocates to work together, and why each of our professions are needed to work with youth. So we know that 33% of teens who were in an abusive relationship never told anyone about the abuse. 81% of parents believe that teen dating violence is not an issue, or they admit that they don't know if it's an issue. And even though 82% of parents felt confident that they could recognize the signs if their child was experiencing dating abuse, a majority of parents, 58%, could not correctly identify all the warning signs of abuse. So if youth aren't telling their parents, or parents aren't believing them, then where can youth go if they are experiencing abuse? And that's why I think it's really important for advocates and social workers to come together to provide those resources. So when I was developing this webinar with Lindsay, I was struggling to understand what exactly the type of work school-based social workers do. And in talking with her, she really explained that there are 4 main areas of work that they focus on. So improving student engagement, case management, meeting and resolving family needs, and connecting students to resources. And I'm going to go into a little bit of detail about each of these areas, but as I was talking with her, I was reminded of the similarity of an advocate's role and how we often wear many hats in our role as well. So within the first focus area, improving student engagement, school-based social workers might do the following. They might build social, emotional, behavioral, and academic skills, facilitate the application of learned skills, oversee or manage attendance and truancy issues, participate in student meetings and conferences, serve on crisis management and trauma response teams, advocate for students' rights and needs, and create school or district-wide inclusivity and safety practices. In terms of case management, their workload might include things like working closely with school support teams, following individualized education plans, providing one-on-one and small group counseling, and maintaining records and tracking student progress. Meeting and resolving family needs includes things like creating support teams, developing family strengthening strategies, serving as a liaison between the families and the schools, ensuring that families, teachers, and students are well informed, working with diverse and English learners and their parents and families, and an understanding and awareness of different cultures that are in the school community. And finally, connecting students to resources includes things like developing outreach strategies to break fundamental barriers and maintaining community connections and resources for outreach and referral. So I think it's important to know too, and to remember that school-based social workers, unlike community-based advocates, are mandated reporters. So it's important to let those in the school district know that your agency is a confidential resource that youth might turn to discuss their options. That being said, Lindsay's research found that among those in the social work field, there really was no cut and dry guidelines to making the mandated report prior to referring to an advocacy service. So the general consensus, she said, among her classmates, her professors, and the field professionals that she consulted with, was that it was ideal to have what they call in their field a service consent conversation as soon as possible. Excuse me just a second. So for them, the service consent conversation is essentially a conversation where they let the student know that if they reveal things like they're in imminent danger, or if they're experiencing sexual or domestic abuse, that they as a social worker would need to make a report. So Lindsay said that some social workers in the school follow the practice of having that conversation as early as possible so that the student can make an informed choice, maybe trying to decide if it would be safer to go to an advocate first to discuss their options. However, we all know that that is going to vary depending on the school district and their policies. And so we'll provide some strategies that school social workers and advocates can use to help inform students of their rights in just a little bit. Okay, so when I was talking with Lindsay, I wanted to understand more about, well, what can a school social worker do to help a student who's been experiencing domestic or sexual violence within their school? Um, and then from there, I wanted to understand why an advocate with their client's consent might want to reach out to a school social worker. And it turns out that there are actually quite a few ways that social workers can help students who have experienced domestic or sexual violence, starting with accommodations. So school social workers can often be the ones to arrange academic accommodations, to help students switch out of classes if they need to change schedules around. Um, they can help with providing access. So things like access to transportation. Lindsay had mentioned making sure that if a student needs safe transportation to or from classes, they can often provide a public bus pass or public transit pass for students. They can provide access to a safe phone if the student needs to call a resource for help. It's also things like resources. So school-based social workers can help students get connected to resources both at the school and within the community. School-based social workers can also do things like talking with teachers for the student without disclosing what's actually happening, provide short-term counseling, and then getting students connected to a confidential advocacy agency. And so while school social workers can provide counseling, Lindsay was sharing with me that most school-based social workers don't really have any training around safety planning or legal rights, which is why I think it's important to get an advocate connected as well, because we're able to provide those additional resources and services to youth who might be experiencing this violence. So now I'd like to talk just a bit about some of the strategies that Lindsay and I brainstormed for school-based social workers and advocates to do in their work to provide services to youth. And I think first and foremost, we want to identify what our survivor needs are. So we know that youth survivors might have unique needs that they need attending to that maybe counterpart adult survivors don't necessarily need. So like we mentioned, they may need accommodations within a school setting. They may need access to transportation. They may need a resource for safe housing. And so working with school social workers, I think, is really important because they are often seen and interacting with youth in the community regularly. And that can help us as advocates understand what the students in the area might be experiencing, and more importantly, what their specific needs are. And I think understanding this will help all of us to provide a trauma-informed approach to our work with youth. As always, I think education is going to be a critical strategy for us to employ. And I think when we're talking about education, I think we need to think creatively, right? We are still in the midst of a pandemic. We know that some schools are doing in-person learning and some schools are doing virtual learning. And we need to be able to plan for that. And, you know, maybe a silver lining of the pandemic is that many of us are now used to doing virtual trainings, right? So how can we partner with school-based social workers in our area to do trainings? And I think the trainings that I'm talking about are things like simple, basic sex education, helping students and staff and their families to identify what are the signs of a healthy relationship, what are the signs of an unhealthy relationship, thinking about specific coping methods that we can talk with students and staff about if they know that somebody that they love is experiencing abuse. You know, and I think the education itself, we need to think creatively about the types of education that we're providing. Are we providing interactive sort of virtual lessons? Are we going in person to the schools? Are we collaborating with the social workers to develop that trust building with the students and the staff and the families? And I do keep mentioning those three populations because I think you can't train one without training the other. If we're only providing education to students, where are the staff going to go if something happens? Or if we're only providing training at the schools, already knowing that many parents aren't aware of these situations, I don't think it's going to be as effective. So another strategy that Lindsay and I talked about was things like developing protocols and getting involved. And so some of the strategies that we brainstormed was inviting social workers in your area to join SMART teams if you have them, or vice versa, if you or some of your advocates on staff are connected with the school in any way, maybe figuring out, do they have like a PTA that you could join? Or are there school committees like threat assessment teams, which many K-12 schools are starting to develop, that you could join? And so within that, excuse me, within those teams, I think that allows us the power to collaborate to create resources for students to know what their rights are. And then there's tried and true methods, you know, things like putting signs in the bathrooms to let students know about information, how to access the resources. It's been a long-standing method that's been tried in a lot of college campuses, and it works. It's a private place for students to get that information and then to know where to go to have a confidential resource. And I think ultimately, you know, whatever strategies you decide to use, I would encourage adopting a comprehensive approach that utilizes primary, secondary, and tertiary prevention strategies. So I think a lot of times when we talk about prevention, we talk about things like primary prevention. And primary prevention is great. The idea is to prevent the violence before it occurs. But as we've already learned from the statistics that we talked about in this webinar, violence is already occurring among our youth populations. And so how do we prevent it from happening again? How do we shift the cultural norms so that people are thinking in terms of primary prevention, but also reducing the violence that's already occurring? So last, I just want to share a few resources. So of course, first and foremost, I'm going to share Standpoint as a resource. We have attorneys and advocates who can answer your legal questions, you know, not only about things like youth rights or Title IX or school policies, but also things like confidentiality. How can you work with school-based social workers in your community and maintain your confidentiality as an advocate? There's Day One, who can provide resources for accessing statewide crisis lines in the area, as well as shelter. And then I always recommend Love is Respect. I think Love is Respect is it's a great website. They have sections that are very specific to youth, including youth safety planning resources, some of which are digital and some of which can be printed out. So depending on what the youth in your area need access to, they have both. And then I was talking to Lindsay and I realized I don't really know how I would even go about getting connected to social workers in my area as an advocate. And so she recommended the Minnesota School Social Workers Association and the National Association of Social Workers Minnesota chapter. And so I went and looked at both of these websites. I think they provide a lot of really great information about the type of work that's being done for within the social work field, and maybe gives us some ideas about how we might start bridging some of those connections. And with that, I'd like to end and just see if anyone has any questions.
I don't see any coming in. If no one else has any other questions, I just want to thank Traci for presenting today. Thanks everyone for coming out. And then if you want to watch this later, I'll be sending out the video to the listserv as well as on YouTube when the video is complete. Thanks again, everyone. So I'm going to end this webinar if there are no questions.
Thanks, Jay.